Well, the pandemic is having a severe impact on global lifespans. In the U.S., COVID-19 was the third leading cause of death in 2020, behind heart disease and cancer. Now, the virus has claimed more than 812,000 Americans since the start of the pandemic. Nathan King tells us more.
Not surprising, these figures, but still incredible. The first real dip of its size that we've seen since the era of World War II. Of course, women tend to live older than men, so their life expectancy is still quite high, but life expectancy overall fell from 78.8 years in 2019 to 77 years in 2020. That's just quite incredible. And then if you look at this chart, you can see how the disparities in the so-called death rate. Hispanic male death rates up 43%, Hispanic women 32%, black male deaths in the US up 28%, black female deaths up 25, white male 13, and female deaths up 12. Now, COVID is not the main killer. It's number 3. The first one, of course, is heart disease. The second one is cancer. But a lot of people, of course, did not get treatment for those other diseases because so much of the healthcare system was concentrated on COVID and they couldn't get appointments. That has exacerbated the death rate as well. We also saw more disease, and this is really interesting. Death from complications due to diabetes rose in 2019 to 2020, surpassing 100,000 deaths for the first time, the CDC report found. Meanwhile, there is a silver lining in the battle against COVID. Regulators announcing that Pfizer's pill to try and stop the worst effects of COVID is actually now going to be authorized. Paxlovid, essentially, according to Pfizer's own research, if you take it and you're at high risk, in the first few days you're tested with COVID or you show symptoms, your hospitalization and death rate is lower by about 88 to 89%. That's quite incredible. The problem is you need to test, and there aren't huge amounts of tests. As we know, 500 million are on the way due to executive order from the White House. In January sometime they'll be start to roll out. But these pills will really help. Now, there is a lot of other treatments in the works, but really the treatment that everyone needs is the vaccine. And as you know, here in the US and elsewhere, not everyone is getting it, or boosters either. Nathan King, CGTN, at the White House.